For Black History Month, we've been shining a light on culture, history, and legacy. But tonight, we're focusing on healthcare.
It is a basic human right, but not everyone is getting the same treatment. 10 TV's Brittany Bailey reports.
The pandemic made just about everything in life just a little bit harder, and that included getting access to health care. Hope Lane Gavin says that was true for her, even in the midst of an emergency.
It was, we are only taking emergency patients. We're in the thick of COVID. And I'm like, I understand that, but trust me when I tell you this is emergent.
She says her words were not trusted and, in fact, were dismissed, but she kept pushing.
When I did get there, they were like, oh, this is an emergency. And so I was then scheduled for an emergency surgery the next day.
That experience is not unique, and the evidence is in a survey released this year by a group of healthcare advocacy organizations.
Black men and women experienced, from our survey, far more discrimination in the healthcare system than white men and women, particularly white men.
In the survey, Black patients, particularly Black women, reported being treated with less respect than their white counterparts. And the most common reactions were to not return for a future appointment or to accept that treatment as a fact of life.
For 800, almost 900 respondents to say, yeah, I've been discriminated against in a healthcare setting. That is a very powerful piece, and that we can use that piece. We can use the survey. We can use the results of the survey to actually elicit some change.
Health advocates say some longtime policies are changing, such as using race as a determining factor in C-section decisions. But others are still common, including looking at race in determining kidney function and treatment.
You can help to remove those discriminatory practices by creating good policies and good review and looking at the data and understanding what's happening. The question is, do they have the will to do it?
One local institution already making healthcare equity a priority is Nationwide Children's Hospital, which was not included in this recent survey.
Being able to provide that care in a culturally competent manner is something that we strive to do.
Nationwide points to its Stand Against Racism, Stand for Health Equity report. It includes 7 pillars to make anti-racism a priority and evaluate the progress.
This is not easy work. But we're in it for the long haul, because a lot of these issues weren't created overnight, and so the solutions are not going to occur overnight.
The moment is now to make some serious changes in these spaces, and so I'm just hoping that the momentum continues.
Brittany Bailey, 10 TV News.
Well, the goal now is to get more hospitals and healthcare systems to sign on and pledge to make changes. Already, ProMedica in Toledo, which has 11 hospitals, is jumping on board.
All right, we made it through